It's still loading. Oops. All right, let's see if it's showing us live. All right, well, just go ahead and get started. I'm just going to record this just as a backup in case it did not work. All right, let's see. Good evening, everybody, and happy Therapeutic Recreation Month. My name is Micah Barshay, and I'm excited that you could join us. This evening, we have a panel of recreation therapists from across the country working in a variety of different settings. I encourage you, the audience member, to add your questions to the chat, and we'll try our best to answer them. Please be sure to indicate who the question is for. And before we introduce themselves, I would like to thank our panel for taking the time out of their busy lives to share their love and passion for the field of therapeutic recreation with us this evening. Across the country, working in a variety of different settings. I encourage you, the audience member, to add your questions to the chat, and we'll try our best to answer them. April, do you want to kick us off? April, you're on mute.
Good evening, everyone. My name is April Green, and I'm a certified therapeutic recreation specialist. I work with the behavioral health population, specifically with women who are pregnant and postpartum up to a year. I live in Baton Rouge, Louisiana, and I have been a practicing certified rec specialist for 3 years.
Katie, you want to introduce yourself next?
Hi, I'm Katie Vada. I am the owner of Caliber Therapies. We are a contracting company based out of Texas, but we offer services throughout the country. We are completely community-based. We work with IDD populations as well as brain injury, and we work with all ages. So I'm here representing the community integration side as well as the business owner side. And I've been practicing since 2013.
Thank you, Katie. Shelby, do you want to go next?
Hi, y'all. I am Shelby Sharp. I am currently teaching at Texas State University in recreational therapy. My background is working in community rec therapy with military, and I've also been certified since 2013. And I've moved around and worked in different regions, Boston, Georgia, Oklahoma as well.
Thank you, Shelby. Shar?
Hi, everyone. My name is Charmaine, but you can call me Char, Whitehead. I currently work with the veteran population with the VA. I've been doing that for almost 6 years now, but kind of been all over the spectrum here, from community to behavioral health to elderly to long-term care, also private practice and contractual. I'm originally from Detroit, Michigan, but I'm currently in California. And those are the only 2 places I've practiced, in Michigan and in California. And I've been a rec therapist since 2014. So happy Rec Therapy Month.
Yes, indeed. Tara.
Hello, I'm Tara Loy Ash. I am currently an associate professor at Southern Connecticut State University. I also coordinate the graduate recreation therapy program there. So I've been in higher education for about 10 years. And before entering higher education, I worked in long-term care for about 17 years. So I have been a CTRS since 2000. So I've been around a little bit, and I've held different positions in long-term care, so mostly nursing homes, but my background is in aging and older adults, and most of my research focuses on perceptions of aging and how that impacts the care that's being provided to residents.
Thank you. And again, my name is Micah Barshay. I'm a certified therapeutic recreation specialist and certified parks and recreation professional. I'm currently living in Rutland, Vermont, and I work as a program coordinator and facilitator at Castleton Parks and Rec. We are a department of one, so I do a little bit of everything. Most of my experience has been working in the parks and recreation setting, and I have also worked a little bit in psych just to kind of get a taste of that and what it's like clinically. And I'm just going to take a moment and also say that my internship supervisor, Shelby, who you guys all just met, is on, and she is part of the reason why I really have fallen in love with community rec. And Tara was one of my professors when I was at Springfield. So the rec therapy world is a small world. We all know each other, and it really is a family. So thank you guys all for introducing yourselves. I'm going to keep an eye on the chat the best I can. So keep those questions coming, but we kind of wanted to open up with some definitions. There's all these different terms of recreation therapy, therapeutic recreation, activity director, all these different terms that kind of get thrown around. So we thought we'd kind of start with the fundamentals and kind of talk about some of those definitions.
Sorry, I was muted. You can hear me okay now? Yes, okay, perfect. So I think some of the terms that maybe the job titles can get a little bit confusing. And I think the ones that were brought up a little bit earlier or that seem people are interested in really, not really, but can focus on long-term care and working with older adults. So we have a CTRS, which is a Certified Therapeutic Recreation Specialist. As a CTRS, you can work with any population. You are nationally certified through NCTRC. So that means once you have that certification, you can fill pretty much any role related to recreation and offering services within our scope of practice. You might hear the term activity director or ADC, which is activity director certified. So that's specific to long-term care and nursing homes. That's a separate certification. And generally that is a training program that you attend. I believe there's 2 sessions. You take an exam, and then you are certified as an ADC, which is different from a CTRS. The education requirements are different. I believe a bachelor's degree is not required for that certification. And again, the amount of specific education is different. And that's generally if you just want to work in long-term care. In Connecticut, the state of Connecticut, there is a specific, but something unique to Connecticut is a TRD, which is a Therapeutic Recreation Director. And that is something that's only recognized by Connecticut. So I believe you need 2 or 3 therapeutic recreation specific courses in order to become certified through the state as a TRD. So when we're comparing, I know some students and some other professionals have asked comparing between the TRD and the CTRS. TRD specific to Connecticut, CTRS is national. So as a CTRS, you can hold a position as an activity director, as a recreation director, and again, my experience long-term care in that area. TRD, that's generally just if you want to stay in nursing homes and if you want to stay in Connecticut. So there's a little less freedom to move around with that. But I will pass it to Katie, who has some other definitions too.
Thank you, Ms. Tara. I believe it was in 2015, ATRA made an official designation between the TR versus RT debate that we had for forever. And so ATRA defines therapeutic recreation as the field, and then recreational with the AL therapy as the practice, and then the recreational therapist as the practitioner. So I know for me personally, it took a lot of practice to break the habit of recreation therapist. And I know it's still the official title in a lot of working areas, but hopefully with a lot of conscious effort and advocacy, we can all have a unified language to help further strengthen our profession.
I believe that ATRA also endorses the CTRS as the preferred provider as well.
Great. Thank you both for your knowledge on that. Again, if you guys have questions, please keep them coming in the chat. I guess for everybody to think about, what is some things that are your favorite interventions to run in your given setting? Do you think?
I could go. For me, it's adaptive movement. I love movement. I uh I am certified in additional movement interventions. I'm a Chair One fitness instructor. I'm a Pound fitness instructor, a Pound Unplugged fitness instructor, and I'm also a Chair Chi instructor. So I utilize all of those additional certifications that I've gotten in my practice at the VA to provide adaptive movement for declining residents or residents that are in rehabilitation. I also use it in my private practice as well, but I try to make movement fun. And the program that I provide, I utilized on myself during the pandemic. I used to be 270 pounds. And so I had to find a way to make fitness fun and engaging for myself in order for me to stick with it. And I don't know, people just started asking me how I was doing it. And I was just like, by my education. And, then it became a thing. And so people started asking me to teach them about it and just kind of spiraled from there. So music and movement is my jam. So yeah, that's my fave.
Great.
Shar, I love that you brought that up, your additional certifications, because I don't know if a lot of folks even on this call realize that you can have complementary certifications to your CTRS that really help with your practice too.
Oh, for
Um,
sure. I
yeah.
mean, I can't speak for other people who don't work in federal, but I know in federal world, it really it helps. Plus in federal world also, if you're not certified to do it, you cannot teach it because they can't put liability insurance on you. So that's kind of like environment specific depending on your company that you work for. But another good thing about it is the fact that I can utilize it outside of my job and for my own financial gain as well. So that's how I'm able to take private clients and things like that because I do have the additional training. So if you have an opportunity to get certified in something else, I will push you to do that.
That's really great advice for sure.
I have so along that topic, I have an additional certification in as a certified dementia practitioner. And then I also have the CARS 1 certification, which is oh my gosh, certified adaptive sports specialist through Blaze Sports. But going back to interventions, when I was practicing, I think my most favorite interventions working with older adults, working with the dementia population was animal-assisted therapy and also reminiscence therapy.
Also great ones.
I have the specialty certification through NCTRC for community integration. And I have had the Chair One Fitness certification as well. I really enjoy Chair One. That was great when I was working in long-term care. But now in community integration, the world is really our oyster. And so the world is our intervention. And so one of my favorite things to really lean into is all the research on like forest bathing and being out in nature. So I really like to do scuba diving with our clients. We do adaptive fishing, kayaking, stand-up paddleboard. Being in Texas, it's hot like 50 weeks out of the year. So anything on or near the water is really like where we want to be. And so that one's really fun. But we also have had some of our RTs do some really amazing interventions. One of our RTs took their client to do some skydiving. We've done also indoor skydiving. And we go to the shooting range, archery, all the adaptive sports. So anything and everything that keeps us active.
Great.
Can I still answer, or did we want to move
Go
on?
for it. Yes.
Okay, so currently working in academia, I do more supervision of care, helping our students practice those therapeutic skills. But we do an adaptive aquatics program partnering with our special education program through the school district and our Parks and Rec department. And we get in the water and we are using the water to work on different social skills, work things like following, um, playing with peers, cognitive skills, following directions, impulse control. We do a lot of group games. And so it has been exciting just to see the growth in our participants because we work with a lot of the same kiddos for a few years at a time, being with the school system. And we have one swimmer that refused to get in the water to now we can't get him out of the water. And it's just wonderful progress. I would much rather have that battle than trying to um, coax them in. So, and then having our students learn how do we navigate this and getting them in and getting them independent in the water. So that's our next task is getting them to not hold on to their buddy the entire time. But adaptive aquatics is currently my favorite intervention that we're doing.
Therapeutic aquatics is pretty awesome, and it's again going back to what Shar said. It's another one of those certifications that if that's something you're interested in, it's just a course, and you can teach adaptive aquatics and add that to your resume.
And I'll go next. I am at a perinatal mental health unit where we have a 10-bed unit. So I really enjoy mindfulness and movement. So I pretty much will provide interventions such as yoga, we'll do chair exercises, any type of meditation, therapeutic music, creative expression. So I try to get the women out of their rooms and get them into the group sessions so that we can express whatever emotions that they need to express, and then to also cater to whatever their reason for being there is. So I generally am a mindful meditation type of person. I enjoy grounding. I enjoy being outside and meditating. So this is something that I really incorporate with the women to help them to decrease their symptoms while they are on the unit.
That's terrific. Good stuff, everybody. So for me, I think it would depend on the setting. In the psych setting, I really enjoyed this activity called 64 squares. Basically, you set up an 8x8 grid with paper, and some of the squares are good squares that you can walk on, and then some of them will send you back to the beginning. And basically, the objective is to get from point A all the way to the finish. And there's a lot of power when they're trying different ways and they keep on failing. But then at the end, when we have discussions, it's okay to fail. It's okay to make mistakes. We learn from those experiences. And slowly they also learn their strategy of trying to mark what the good squares are and the bad squares. So using people that have already been ahead of you. There's a lot of really cool symbolism in this activity that people really get. And it's also really fun for the teens to watch it when you have all these teens that have conditions that they might have been told, no, you're not going to be able to ever achieve anything, or this is too hard. When they achieve it at the end, they are so excited and so happy that they have accomplished that. And then in the community world, it would probably be a tie between Special Olympics. The way Special Olympics is set up with their different teams based off of ability really allows for anybody, regardless of their athletic ability, to be able to find a space that they can participate, whether it be on a team that's unified with people with and without disabilities on the same team, all the way up to really high skilled athletes that are very talented. And everywhere in between is really powerful. And then the other program, I used to run this program called On the Town, where every other Friday we would take people with disabilities to different spots around the Boston area. And I really enjoyed this program that we, as rec therapists, were able to help people with disabilities to do something that was what somebody without a disability would be able to do on a Friday night, whether going to Fenway Park or going to watch a concert, going mini golfing. So we were there as staff and rec therapists to help to make that kind of thing happen. All right. I'm seeing that there's still not any questions yet in the chat. Did any of the panel have a discussion topic that they wanted to discuss at all? I can keep working off the list here.
We talk about education.
Go for it.
Yeah, yeah. So my background, and I don't think we touched on this in our introductions. I have a bachelor's degree in psychology. And for anyone who's kind of new to rec therapy, a bachelor's degree is what is required in order to become certified. And so I found recreation therapy a little bit later in my academic path. So not until my senior year did I realize that the career existed. So after I graduated, I went to Springfield College for my master's in recreation therapy management. And that's when I worked for a good amount of time and decided I wanted to, switch gears a little bit. And then I ended up going to Clemson for my PhD in recreation therapy. So definitely different pathways. I know people on the panel too have taken it a different way.
All different pathways. That actually is a pretty good segue for a question I don't have on the list, but I think it's good to discuss is some fields, some of the other allied health fields are requiring master's degrees versus bachelor's degrees. I know this is more of an intro panel, but did people kind of have thoughts on kind of where things might be heading or which way it should kind of land?
I think in my personal opinion, I feel that the focus of our field isn't going to be more so on heavy on the education portion. I think it's more so heavy on certifications versus licensure portion, which is where I feel that, those who have been advocating for the field for such a long time, the focus is, the drive is there so that we could be included in realms in other spaces, like independent billing, things of that nature. Like some places can, I think there's 4 or 5 states now that has licensure. So, they can do more things when it comes to insurance, which solidifies them, which is where I feel the field and for years have been trying to, get to, where it's like a standard across the board.
Yeah, I agree with Shar. I do think one of the benefits of our profession is that a bachelor's is the baseline for our degree. For getting certified, you still need to have a set of recreational therapy core classes, core content. And a lot of our degrees have a lot of hands-on experiences, and that's where you're going to build a lot of your skills to be a rec therapist. Um, but I think a lot of our profession is looking at how do we build licensure? How do we protect the public? Because that's ultimately what licensure is about, is ensuring that we're protecting our clients because they have qualified professionals that have met the educational standards and have the skill competencies to be practicing and ensuring that they're not going to harm our clients. Uh, so there's 5 states that have licensure and 2 regions, because we just had a branch meeting for a state conference. It's the only reason why I remember this off the top of my head. So the regions, in addition to the states, are Washington, D.C. and Puerto Rico. So Puerto Rico is kind of kicking butt with rec therapy right now. So I think as we continue to advocate, which is a big piece of what ATRA is doing for us, they provide a lot of educational sessions as well, which is important, but they've been working really hard to help define and have this cohesive message that we're all trying to get across. And they have a licensure task force. So where all the states each state cannot have the exact same laws because all the states have these different nuances, but we have similar laws. So if we come from Texas and go to Nevada, then we could still practice because there's similarities in those licensure laws, is what that task force is trying to do. But I think that's more of where we need to focus as far as advancing our field, not so much bachelor's versus master's at this time.
I'm inclined to agree with Shelby and Shar on this. And then from the employer perspective, I think that there should be some designation between when somebody is bachelor's level versus master's level credentialed. The master's level has more in their toolbox straight from graduation than bachelor's does. They have something to rely on. So my undergrad was kinesiology, emphasis in exercise physiology, and then my master's was in RT. And so going into recreational therapy as a practitioner, I was able to pull from my kinesiology background and lean more into adaptive sports with my clients. And so that was really helpful and beneficial. So I think having those designations would be fantastic. And then I've also seen a difference in practitioners who have a degree in therapeutic recreation versus somebody who did the alternative pathway. The knowledge, hands-on skill set, night and day difference. So in my personal, professional, and employer opinion is that we really should have the degreed professional be the minimum entry level and no additional take a couple of courses. None of our allied healthcare professions do that. PT doesn't do it, OT doesn't do it, SLP doesn't do it. So I really think that to help push that licensure and push the strength of our profession forward, that we really need to kind of tighten up there. And then additionally, there was something else that Shar had mentioned, and I thought that was great. Now it's gone, but that was kind of like the main thing. And I do agree with what Shelby said. Licensure versus credentialing is really the big push. And then I always, when I talk to practitioners, encourage everyone to be a member of ATRA. They really do a lot for us professionally. A lot of people don't know that they have a lobbyist that lobbies for rec therapy in DC and helps protect us. And the more people that join ATRA and are yearly members, the more they can advocate for us for licensure through protection, state level laws, all of that. So that was it. It came back.
I don't want to, just a fun fact that I also learned yesterday, only 12% of our profession is currently part of ATRA. So if more of us, even if just 50% are part of ATRA, like what incredible things could happen if 50% of us were part of that membership. So I could talk more about things if people have questions about what the current benefits are. It's fresh in my mind. I got you guys.
And just to piggyback off of you, Dr. Shelby, and I know like the main thing that people say, and listen, I am guilty of it myself because it took me probably for me to be practicing almost 10 years in the field for me to even join ATRA is the cost, right? But I do know that ever since the pandemic, ATRA has made it very affordable for you to join because they have a monthly payment. So if the cost is what's hindering people, I would highly, highly, highly recommend that you look at the monthly option. I think it's like $12 a month or something like that. We spend that more than in a week. We spend more than that in a week in coffee at Starbucks, right? So, but it is very, 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 very important because I mean, I've done a lot with ATRA over the last few years, just be getting more involved in, our advocacy levels. And I will tell you, Brett Wolf and all of them, they really go to bat for us and do a lot of those hard things that we don't even know that they're doing behind the scenes in order to make our lives, more livable, give us a more livable wage and protections in our prospective environments to advocate for us, to let them know like, hey, that is beyond our scope of practice. And this is why they will not do that. And I I cannot tell you enough how much being a part of ATRA has educated me more so on the field of just how to protect myself as a professional, as well as to how to continue to enjoy what we do. So, but that's my 2 cents.
And just to be clear to our viewing audience, we are not endorsed or anything by ATRA. And in case people want to know what this acronym, the American Therapeutic Recreation Association. So really great idea to join it. Again, we are not endorsed. We are just professionals that have really think it's a really important thing for the field.
And I would like to just add one thing. In certain cases, if you are able to go to your employer, you may be able to acquire some assistance with paying for those tools from your employer. I have been trying to work on getting that accomplished myself, but with to piggyback on what Shar said, I think that it is economically feasible if you look at the monthly payment versus the overall payment. I think it should be able to, you should be able to accommodate that economically.
And I want to just add to what April said is a lot of people don't know because they don't check ATRA that frequently. Your membership with ATRA now includes CEUs, which is phenomenal. And CEUs are expensive. If you're trying to get to ATRA, that's expensive. Even regional and state conferences, that's expensive. So if you can have your ATRA membership and have that included, then you're 2 birds, 1 stone. You're helping the profession and doing stuff and getting your CEUs.
And also, if your employer is requiring you to hold any type of certification, such as a CTRS or license, then they should be supporting financially that license. So maintenance fees, ask your employer for reimbursement for that. But if you do have the ATRA membership with the CEUs, then you can make a case that you need the membership to access the CEUs so you can keep the certification that's required for you to continue in your position.
That's a perfect segue. Like you guys mentioned, CEUs or continuing education. Where have people been successful in finding really good CEUs for a good affordable price or really good quality? Somebody who's newly certified and not sure where to
go. Wait, you said newly certified?
Yeah, somebody's newly certified and they're like, where do I find these continuing education?
Yeah, I would always see, this is why you need to be a part of a board, right? Like be involved, right? Because this is where you get that information. Most of the time we have regional things. Like I'm a part of the Bay Area Therapeutic Recreation Association, even though I don't live in the Bay Area anymore, but I'm still a part of BATRA. But that information comes out and trickles down. NCTRC, they send out emails all the time letting you know, hey, this is been pre-approved by NCTRC. So I would always highly encourage newly certified professionals to do in person. Don't do virtual, do in person, because you wanna be in the atmosphere, because it's infectious, and it just reinvigorates you as a professional, and it just kind of solidifies why you chose to dedicate your life to this field and how beneficial it is from all different perspectives, from all different backgrounds, from all different walks. You can get some of that in a virtual, but I would highly, highly, highly recommend that newly certified professionals kind of veer away from a virtual, although it is more convenient, it is easier. It's just you really want to have that experience so that you can learn from the professionals who've been doing it for a long time. And that's what honestly changed my life as a student, right? It was I think it was required when I was an undergrad to go as a student, and we had to volunteer and stuff. And it was amazing. I mean, it was just like, I want to do that one day. I want to be on one of those stages, and gosh, I am, right? I mean, and that segs me into, I will tell a professional who has been certified for a long time, right? And they have so much to offer to the field. I mean, if you present at a conference, you get free entry. So I'm just saying, if you can dedicate an hour and a half, 2 hours of your time for just that little bit of time, you get the whole conference most of the time for free. So I have not paid for a CEU in I don't know how many years, because I'm just like, whatever. I'll just do a session. But also that keeps your name at the forefront of NCTRC so you don't get audited. So because they know, they've seen your name, they've seen your submissions, so they know that you're going. So you will not be audited. So I haven't been audited yet, and I'm knocking on wood. I hope it doesn't happen. But another good thing about that is that now ATRA keeps our CEUs digitally now. So that just say, I don't know, Tara and Katie and Dr. Y'all remember back in the day we had to keep those transcripts and keep up with them for 5 years. You're like, oh my God, I'm gonna lose this paper. So yeah, so grateful for the online platform that they have now to keep our CUs together. April, you in it at a good time, girl. So but yes, us oldies, we remember. But yeah, that's my 2 cents.
I just want to highlight that as well. Attend the conferences and look at regional events. So ATRA is a great starting point, but there's also chapters of ATRA. And specifically in New England, I'm in Massachusetts. We don't really have anything, but we do have NYSTRA, which is New York State Therapeutic Recreation Association. So they've been a great resource for us in our New England states, and their conference is really nice. I'm biased because I'm on the board, but they have a great conference. And also, shameless plug, Southern will be hosting a conference in New Haven for the first time in April. And we have 2 full days, April 24th and 25th, full of CUs.
Thank you, everybody. Great.
And
So we have
I want to, Mike, if you don't mind, I just want to say exactly what Tara and Shar said. Go to the conference, because I went to, ATRA is my favorite conference to go to because I love meeting the practitioners from everywhere. But 2025 ATRA conference, there were 2 practitioners that presented that work at the Mayo Clinic. I think they're in Arizona, and they presented on facilitating recreational therapy in a transplant unit. And they talked to us about how they work around ECMOs, how they work with PT, OT, all of the things. And it was such a cool presentation that I wouldn't have gotten at a regional conference, because we don't have a Mayo Clinic down here in Texas or in the Gulf states. So it was such a cool thing to see and to hear. And that's what you get when you go to conference, and you really leave like totally energized and passionate.
On top of the networking, especially when you're new to the field, that's how you're, meeting people and, discovering different opportunities.
Great. Thank you guys all for those contributions, and thanks for interrupting on that. That's really a cool opportunity that you're only going to find at conferences. So we have a question. Somebody is 1 month into their internship and they're kind of looking for advice as a current intern and then new professional. Do we all kind of want to round robin on some advice?
April, you start us off.
So I have only been working in the realm that I work in for a year, and I have not obtained an intern. But I am working on getting an intern for the fall semester, and I look forward to that experience. So because I don't have as much experience with an intern, I can only tell you that my internship, which was in 2004, over 20 years ago, I did my internship at an outpatient clinic, and I truly enjoyed working in that setting. I never thought that I would be working in psych, but the outpatient clinic kind of gave me that segue to where I am now, to work in inpatient. So I just encourage you to ask as many questions as you possibly can while you're working with your certified rec specialist, to make sure that whatever population you decide to work with, that you have all of the skills that you need. And you're not going to get everything through your internship. You're going to get a good experience, but once you start working and working with a particular population, you'll get a chance to branch off and make your own way in the field. So I would like to ask someone else to give some more insight who might have had interns that could help me out as well.
I mean, okay. I structure my internships quite differently, mainly because I don't want my internship to feel like that they didn't get as much experience as they should have gotten before they got into the field. So I put them anywhere and everywhere I can, everywhere. So my last intern I was working in outpatient, but we worked in outpatient. I took her into inpatient. I took her into the main hospital. I took her out in the field into the community. And then I tasked her with certain things, higher level things that she probably didn't think she would be doing. And then she had her final project. But then also, I told her, if you want me to sign this paper, you have to present at a conference. Yes, my intern presented at a conference because I was like, I want you to get the full experience of what it's like to be a professional. But I will tell you from that experience, that made her like unstoppable. She had a full-time job before she was even certified. And now that she's certified, she has her own business. She has her own clientele. She works in mental health full-time. So she's doing great things. So I push my interns. I push them beyond their comforts because I want you to be uncomfortable, because I want you to realize that you can do so much more than what you think you can do based off of what you've only been exposed to. So if you have an open mind and you give it a try, then you will surprise yourself in the most unique ways. So that's kind of like how I do it in the 16 weeks? Yeah, 16 weeks.
So I'll say that Shar and I seem to have a lot of the same approaches to just about everything so far. Love it. That's awesome. Our internship, we try to push our students into as many different directions as possible. I always tell them that I want you to leave and be able to apply or go into any position and say, I had an experience like this already in my internship. So I have tools in my toolbox. So they get psych experience, telehealth experience, one-on-one group experience. They get it all basically. And so that for students who are looking for internship, that's really my advice is like, try to look for something that is going to be diverse. That's going to give you a whole lot of experience really fast. It's going to be overwhelming, but you're going to step out of that and say, wow, I'm prepared for anything. And I always tell my interns, you're going to have to get comfortable being uncomfortable. You need to laugh at yourself. You need to be able to admit when you make a mistake, because you're a student, you're going to make mistakes. Even as practitioners, we still make mistakes, but it's important that we take accountability for both our clients and ourselves. We learn from it, we grow from it, we move forward. Now, for current interns who are looking to their future and where they want to go, where they want to work, do your research on the employers that you're considering. So much of what people think about when they're looking at applying and interviewing is the employer is asking me questions, but you should ask them questions back. If you're looking at working for a contracting company, it's really easy to find the owners. Go look them up on social media. What's their social media presence like? Are they a representative of what you want to work for, the change that you want to see? That's why I started my company, is I wanted to see the change in our field and I wanted to push things forward. And so if you look up my social media, you look me up on LinkedIn, I'm constantly advocating for our field, and I'm always trying to support and push my own practitioners forward and increase our visibility. And if that's something that's important to them, that's what they're going to see when they come do their research on us. But don't be afraid to ask potential employers questions and interview them back.
I think for me, my advice would be two parts. The first part being the answers are not always at the back of the book. I jokingly remember the beginning of the pandemic, taking out some of my RT books and be like, all right, how do I do recreation therapy in a pandemic? Like, we're all social isolated, we're all wearing masks. What do I do? And as probably the panel can attest, was there anything on the pandemic on how to handle a pandemic? No. But kind of knowing my own thoughts about kind of what's going on, my own anxiety, my own hesitation, and kind of knowing that from the academics, now how can we apply this into a new situation? So I very proudly, within 2 weeks of the shutdown, or not even 2 weeks, within a week of the shutdown, we started virtual programming on Zoom, this new platform, and started doing a morning meditation Monday through Friday, and then a more fun program in the evening. But again, there's nowhere in the textbook that say use this platform called Zoom to do virtual programming. It's using the knowledge that you've learned in academics into new situations. And that kind of creative thought is going to get you so far. That's what employers are looking for, is that creativity. They're not going to have the answers on things. And then I think the other thing is flexibility in both location and maybe even population. If you're really interested in working, I know I was really interested in working in community, but there was nothing really in the Massachusetts area that was open. So when I first graduated, I ended up moving down to Florida for a year just to get some experience before moving back to actually where I did my internship. And I was there for 4.5 years. But instead of, you might have to either settle on this is not exactly the setting I'm looking for, but it's where I'm enjoying, or I might need to make a move. And it's unfortunate that sometimes we have to make that move, but it's the world we live in right now is that these, although there's not as much competition as one might think, there is a lot of competition for other practitioners that are out there. So being flexible is super important.
I will have to say, I mean, I agree with you, Micah. It was difficult, right? Like when you first got out. But I think I feel like for me, because I went to school in Michigan for my undergrad. So I feel like the best experience I had in school was the fact that they required us to work in three different I'm so sorry, do field work hours in three different populations before you even graduate, before you even get to your internship. Because my teacher, Nicole Cummins, I'll never forget her. She always told us that, just because you think you're going to settle in one place, when you work in a hospital, I could be in inpatient one day and then, well, they're short in outpatient, so now they need to throw you in outpatient. Or you're in long-term care, but now the hospice unit is short, so we're going to send you upstairs because we're short and we have to have you there because of CMS, right? So it gives you the mindset of adaptability and flexibility, right? You have to be adaptable. You've got to be flexible. And that's what our field is all about. It's about adapting the situation, not the person, because it's not the person that has to bend. We need to bend the situation for the person so that it can conform for them. So it gives you the mindset early on, like, hey, I have a plan. That plan might not work, but because I know how to be adaptable, I don't have to have a backup plan. I can adapt the plan that I've already have so that it works for what I am doing. So you don't have to feel like you're always recreating the wheel every single day, because every year, guess what? January, February, March, and so on comes on. So every year, every year, every year. So you telling me you're going to do the same thing in January from 2022 in 2026? I mean, it's not relevant still, right? So it helps you to kind of have your thought process a little bit different so that you can be a resource, because that's what we are. We're resources, and we're the best of the resources because we're not centrally focused on one thing. We look at the totality of it all, and that's why we're so valuable, because we encompass so much in just one human. So that's my piggyback. Yeah.
I would piggyback off of your piggyback that what you described with being in three different locations. I think that's terrific. I think a lot of the time when we're in college, we have the opportunity to try different populations in different settings. Summer vacation is a wonderful time to go do some volunteering or go try to find a work experience and get that practice in. And that's going to look really important to employers. Employers, more than grades, more than certificates, or more than degrees, they're looking for that experience. So if you can diversify yourself, that's only going to help you in the long run. And who knows, you might just find a setting that you never thought was going to be interesting to you. I thought when I started college, I was going to go work in a nursing home, and then I ended up in community. So you never really know until you try these different settings. I think, and one thing NCTRC could improve on is, instead of doing one really long internship, requiring to do more different settings to try different things out more formally. Because I think just focusing on one area is kind of a disservice.
I would suggest also, in addition to completing an internship, depending on what your program requires or what is offered, is volunteering. So I know there are different programs on different college campuses that also have organization. So as an example, we have our Institute for Adaptive Sport and Recreation at Southern. So we have a lot of volunteer opportunities. So maybe your internship is, working with older adults, but you can also come and volunteer and, at a wheelchair basketball game. We also, have a memory cafe, things like that. So see what resources are on your campus and what is being offered so you can get as much experience as possible with different populations.
All right, that was a really good conversation, really great advice from some great professionals. So if I want us to think about kind of the future of recreation therapy and kind of what are some hopes that we have for the next 5 to 10 years based off of your work of where recreation therapy could be headed. So if you have any thoughts, while you guys are thinking of your thoughts, I can go over kind of my thoughts. One thing that I think recreation therapy can work on is that continuum of care. In community, there's not always that connection with the clinical side. And what I would really love to see is a connection with your Parks and Rec departments, along with psych hospitals or physical rehab hospitals, where the person is in their acute setting, and then there's a conversation with your local rec therapist in their Parks and Rec department, and that transfer can then take place there. And then if that person ends up back in the hospital, there's review of notes and we're not that way each time the person's getting discharged and admitted. We're not always starting over from scratch. So that better communication and that better continuum of care within the community instead of there just being that cutoff.
I agree with you, Micah. I'm in an acute setting, inpatient psych, so unfortunately there wouldn't be any volunteering on my particular unit, but the continuum of care is very important, especially if I'm not able to allow the patient to have access to resources once they leave me. It's almost as if I have to repeat it, especially if the patient returns back to me. That is the continuum of care, unfortunately. So there's a disconnect between the inpatient stay and then once they are reintegrated into the population. So I would also like to piggyback on something else that you mentioned. As far as the populations, the particular hospital that I work at, it is a unique population because it's fairly new. There's 4 hospitals in all 50 states that cater to pregnant women. So this is something that recently came up. And as I stated, this is a hospital that's been open. I might not have mentioned this, but this hospital has been open only for a year. So as you develop yourself throughout your career, there may be some more accessibility to other populations that you can start those programs. So I'm in the process of starting this program at this particular hospital and ensuring that I am bringing the best value of recreational therapy, advocacy. I've been able to work with this unit for over a year and to also be introduced to other units within the hospital. So not only am I introducing myself as a recreational therapist to this facility, I am also introducing myself to other units within the hospital. So I work with the perinatal mental health population inpatient. And then there's also opportunities for me to introduce and advocate for rec therapy in our high risk unit. So the high risk unit is where some of those patients are housed and they have to stay bedbound and they're not getting any kind of care as far as whatever diagnosis they may have in combination with their medical issues. So right now, I am also trying to establish some sort of a program with rec therapy onto those units. So you have the opportunity to create a lane, or you have the opportunity to work with someone who's already established something to introduce recreational therapy and be an advocate for the field.
I would like to say, like, in the next 5 to 10 years, I'd like to see more states with licensure for RTs. And then I'd also like to see more RT collaboration with our allied professions like PT, OT, and SLP. I always say, if we can all collaborate, if we were like in the VA able to all co-treat together, like imagine, and VA does get to see this, but the outcomes that are produced when we work all together as a treatment team instead of competing, and that's just phenomenal. And so I'd love to see more partnership and collaboration for our field. And I'd love to see practitioners get more comfortable utilizing evidence-based practice and utilizing the research in their advocacy efforts, whether it's with their employers or joining their state organizations for licensure, whatever it is, attending cool RT groups like the ones that Micah hosts, where it's just an opportunity to network and talk about your practice. All of that is really phenomenal, and I'd love to see RTs get more involved.
I would agree that the future is licensure. I think being able to, provide that for all of our states and pursue that, because then I think people will take us a little bit more seriously. That, now a lot of individuals don't exactly know what we do, or, a lot of them probably aren't familiar with the field until they actually need us. And, we're still a young profession. We haven't been around as long as OT and PT and some other allied health professions. So I think moving forward, I think licensure is going to be a really big step for us to ensure the longevity of rec therapy.
So a lot of the similar things, licensure. I definitely think the interdisciplinary collaboration will be really nice to see. I would like to see more practitioners getting involved in the research, and working with institutions, and we're collaborating together to help with that research process, because it can be intimidating, it can be complicated, but like especially with what April's doing, and maybe I'm a little more sensitive to that population being a new mom myself, but like that's an area that we really should be exploring and getting that evidence out now that it's new, and um, how rec therapy would be so beneficial for postpartum. Because I know for myself that it's very, very important, and um, just having all of those collaborations and those relationships to continue to build the evidence, um, the scientific part of the evidence, because it's not just science, it's also our knowledge and our clients as well when we're looking at that. But I'd love to see the research piece grow a little more.
I think it's important to kind of reiterate what we kind of touched on with the advocacy. Advocacy is not just something that's on your job description that you're doing 9 to 5 or even working 9 to 5. But it's something that every time we go out and we introduce ourselves and people ask what you do for work, it's an opportunity to advocate. Anytime we meet somebody on the street that has a disability, it's an opportunity to advocate. The advocacy for our field never really ends. It's just something that's super important to continue moving forward. So we've got a couple more minutes left. Did anybody else have any other discussion topics or anything else what we wanted to share with kind of our future rec therapists or people that are interested in the field?
I would like to say never give up. Advocacy is very important. Perseverance is also important. I received my bachelor's degree in 2004 from Southern University in Baton Rouge, Louisiana. And it took me up until 2023 to actually obtain my certification. So if you are interested in rec therapy, you're passionate about it, I encourage you to pursue it, to make sure that you tap into every avenue that you're interested in working in, and to see whatever population you're interested in working in, and just persevere through whatever challenges that may present themselves to you. I had a lot of challenges as I graduated in 2004, just trying to obtain a job. I was not successful in obtaining a job directly in recreational therapy, but I did work indirectly in a role that kind of allowed me to utilize the skills that I gained in education, and also just through my internship. So I worked for a disaster recovery company for a long time, and I assisted homeowners who were here in Louisiana affected by Hurricane Katrina. So not only was I a case manager, I also worked in the realm of mental health for people who were affected by those storms. So that put me back into the realm of recreational therapy, and it inspired me to want to pursue my career even more so that I can be in the position that I am now. So I created a vision board. I put certification on that vision board and I made that my focus. And I'm actually working in that reality. And then to be working in a new population and to really reacclimate myself back to the recreational therapy field. It is a pleasure to be on this panel with everyone who has so much experience. I am still learning a lot of things myself, and I'm putting all of these tools into my toolbox so that I can prepare myself to grow and to continue to advocate for the field. So I want to make sure that at any point, any encouragement that's needed, encourage yourself and then do your research and just find something that you're really passionate about and go for it.
To add to that, don't be afraid to ask questions. And, don't be afraid to pursue opportunities that maybe aren't necessarily traditional to rec therapy. And I think April is a great example of that. So she's kind of blazing a trail in a way for future rec therapists, in postpartum maternal health. So I think that's absolutely amazing. So I would just say that because, you're all the future. That's why I tell my students, you're the future. So where's rec therapy going to go? Look in the mirror, like it's wherever you are, which is such a great thing.
Well,
I would
wanna
say
thank-
oh, sorry, Micah. I keep cutting you off. For any students that are attending Texas State or Dr. Shelby, if you guys want to get involved with us, we have an agreement with some weekly groups that we run that students can come and they can observe or they can participate with the RTs that are running our group. So if you want to come in and you want to see what recreational therapy looks like in practice in a group setting, you can definitely reach out to us through our website or Dr. Shelby, we can form some kind of something and the students can definitely come down in groups or by themselves, whatever they want to do. And they can even do practice facilitation with our RTs for our groups too, and give them a really hands-on look into what that looks like in real life. So, yeah.
All right. Well, I want to thank the panel so much for their time. We know that you guys all have busy lives, but thank you guys for joining us live and reach out to your local recreation therapist, and we will talk to you guys all soon.
Thanks for having us, Micah.